Hello, I'm Charity Cox-Hayden. As Chief Nursing Officer, I want to welcome you to Banner Cardiovascular Centers. Banner Cardiovascular Centers offer outpatient procedures dedicated to total care with a personal touch. Today we'll be showing you what you can expect on the day of your procedure. Our caring team will ensure a safe and welcoming environment before, during, and after your procedure.
I'm Bill of the Clinical Operations Team at Banner Cardiovascular Centers. Banner Cardiovascular Centers are committed to providing you with excellent care every step of the way. This video will walk you through your experience at the center so you'll feel comfortable and confident during your time with us. Prior to your arrival at the center, please ensure your medical passport has been registered and completed with your accurate medical information so we can safely screen you prior to your procedure. This will also ensure that we're able to communicate important clinical care instructions and insurance information with you leading up to and after your procedure. You will receive communications via text and email with a link to complete your medical passport, or you can visit onemedicalpassport.com. All patient estimates will be communicated in a timely manner to the phone number and email address we have on file for you. A digital welcome message will be sent to your mobile phone and email. Our financial counseling team is available Monday through Friday from 8 a.m. to 4:30 p.m. Mountain Standard Time and can be reached at 480-292-8541 if you have any questions regarding payment. Before you arrive at the center, please remove all jewelry, including piercings. If you have hearing aids, please bring them with you to the center. Please remember to follow your physician's instructions for fasting and take any morning medications with a small sip of water if instructed to do so. You may bring your cell phone as well as your wallet or small purse with your photo ID, insurance card, form of payment if needed, and your advance directive if you choose to have one on file. Please leave all valuables at home. Please wear loose-fitting, comfortable clothing and supportive shoes. This means no flip-flops or sandals. A nurse will be calling you prior to your arrival at the center to inform you of any current health and safety protocols that are in place. When you arrive at the center, you will be greeted by a team member. You will be asked to take a seat in the waiting area until you're called to the desk to start checking in. The registration process will take approximately 5 minutes. We will verify that we have the correct spelling of your name, date of birth, and demographic information. Your support person's contact information will be verified or collected so our team can contact them when your procedure is completed. One of our team members will place an ID band on your left wrist. Our goal is for the registration and check-in process to run smoothly and for the team to be as helpful as possible. During the pre-procedure process, you will be escorted by a nurse from the waiting area to a pre-procedure area where your name and date of birth will be verified and you may be weighed. You will then be taken to a pre-procedure room where you may be assisted to change into a gown and surgical cap. At this point, your vital signs will be taken and documented, and you will be offered a warm blanket for your comfort. We will review your procedural consent with you at this time and verify your understanding of the procedure. During this time, your physician will explain your procedure in a way that's easy to understand and answer any questions you may have. Please be sure to have all your questions answered before you sign your consent. Your nurse will provide you with discharge instructions for a successful recovery at home. This information will be provided to your support person upon discharge in more detailed written form, so please do not feel that you must remember everything at this time. Next, if you will be receiving anesthesia or sedation, an IV catheter will be inserted by the nurse. If anesthesia by an anesthesiologist is required, your anesthesiologist will explain the process for administering anesthesia, and you will sign a consent for anesthesia. Your procedure room nurse will come see you when they are ready to take you back to the procedure room. They will verify your name and date of birth, and that the correct procedure is documented. They will explain what will happen once you are in the procedure room, and they will remain with you throughout the entire procedure. Upon your arrival to the procedure room, your team will be there to welcome you. They will introduce themselves to you and explain their roles. You will be transferred to the procedure room table and be connected to equipment that will closely monitor your vital signs during the procedure. The length of your procedure depends on what procedure you will be having. When it is complete, you will be taken to a post-procedure recovery room. Your time in the recovery room will depend on your individual recovery time. You may receive oxygen and be asked to take some deep breaths. This will help eliminate the effects of any sedation you may have received. You will have a dressing on your procedural site. Your vital signs will be closely monitored by your nurse, and you will be asked about your pain or nausea and be provided with medication if needed. The team will also explain to you what to do if you have pain, additional nausea, and/or subsequent bleeding after you arrive home. When you are ready for discharge, you will be assisted to change into your own clothes. Remember to wear something that is loose-fitting and comfortable that will be easy to put on. For your safety and to prevent the risk of injury, members of your patient care team will assist you with dressing and all movement during the recovery and discharge process. Your recovery nurse will keep your support person informed and let them know when you're ready to be discharged home. Your support person will be asked to pull their vehicle up to the patient discharge area, where your nurse will take you via wheelchair and assist you into the vehicle. From all of us at Banner Cardiovascular Centers, thank you for trusting us with your care.